Are you ready to feel and look younger? Feeling wired, tired, and overwhelmed? Younger with Dr. Robin Benson will help you turn back the clock, feel better, look sexier, improve your brain power, and activate your younger DNA potential. Welcome to Younger with the latest from science and top health experts worldwide. Here is your host, Dr. Robin Benson.
Hello, everyone. Dr. Robin here, along with Matthew Moody, a nurse practitioner at Santa Fe Soul Center for Regenerative Medicine for the past few months. We are so blessed to have Matthew with us. Oh my goodness. I mean, already he's worked with our clientele locally and across the nation and internationally. So many people are in need of guidance with their hormones, with finding out more about peptides. We're learning about things on social media all the time, or we're wanting to see how we can improve our vitality, how we can improve our sleep. So many people are looking for really healthy remedies for weight loss. So Matthew comes with quite a repertoire of offerings. And, some of the things that Dr. Christy and I have not been able to offer, such a blessing, almost 20 years here at Santa Fe Soul and my 32nd year in business. And to have a colleague like Matthew, somebody that I've actually known for 3 decades, and now for us to work together and collaborate under one roof has been a dream come true. So welcome, Matthew.
Thank you. And it's a dream come true for me too. I just, my time at Santa Fe Soul through the years, just popping in, I always had a hit that maybe I could be here one day. I just didn't see how it was going to happen. And it found us. So I'm pleased.
It's such a perfect time. And I love that you are going to educate everyone who's listening about about peptides. Peptides is a wonderful opening field of regenerative medicine, actually, right? When people want natural alternatives to prescription drugs and all the possibilities in terms of they're great for sleep, they're good for your skin, good for your biome, injuries, inflammation, all kinds of things. So let's start by talking about peptides and what are peptides?
So I was able to start exposing myself. We'll talk about hormone replacement too, but I'm certified with an amazing company called Avexipel, and they're by far hands down the leading, most advanced hormone replacement company in the world as far as pellets go and the way they make them. And their pharmacy, Pharmakeo, also carries all the peptides. So when I go to trainings, of course, it's a separate training. I'll be going back for just specific peptide education again in July, and hopefully taking Tom, our wonderful Tom, here with me, since he's really into that too. But peptides are basically made amino acids, short and long chain, and they mimic things the body are already doing. And Dr. Benson mentioned injury. A lot of people have had access to this for quite a while, celebrities, sports athletes. We're just starting to hear the word as a buzzword in the normal community online. If you go to YouTube, there's a whole lot of information there. So most of what I find is pretty good. It's accurate. And for example, Dr. Benson does a whole lot of injections for injuries into knees, joints, hips. It can do the same thing. In fact, it can be a wonderful precursor to those kind of things. Directly injected into the hip, what it does is brings 2 to 4 times the ability for healing at a much greater speed to that area. So another one, for example, they're all different categories. The GLP-1s, everybody's hearing about, the miracles of semaglutides, Ozempic, and these things. That's what it is. That is actually a peptide. We just don't know that. And because of that, now we can offer a whole weight loss repertoire here. Sometimes using that, different things are different from different people. Nothing is good for everyone. So we've got a whole lot of palettes to choose from on a whole lot of levels, from Western medicine all the way to fully holistic.
There's so many different peptides right now. So what are some of the top 3, especially for our audience that is all about regenerative medicine. So for those of you who've not heard that term, it's looking at how we can turn any type of degeneration and how can we regenerate new healthy bone, new healthy tendons and ligaments in our body? How do we produce better collagen and elastin in our face? So tell us a little bit more about how this can be helpful and what those top three, Timmy's top three peptides that are used in regenerative medicine.
I would say, I mean, there are literally hundreds of them, but when I look at the collections, they're starting to compound them too. So you don't have to specifically do one thing that only does one thing. I would say right now, the things that are coming to the top of my head that I'm most excited about, like working with Aldo here, working with our bodybuilders, our weight trainers, our people who are really doing that, who are also getting hurt in the gym. The Samorlin is amazing for muscle building, and there's multiple types of Samorlin. So that's one of the ones there. The copper, the tirzepatide is the second generation of semaglutide, and it's about to be bypassed by another one that's coming on the market probably in the next 2 or 3 weeks that Pharmakeo is getting ready to release. So those are all different categories. You've got one that's talking about great for blood sugar and diabetes and weight control and getting it off. You've got another one, and they all cross over. I mean, they all cross over doing things, but you've got another one that is actually helping to maintaining your muscle, or putting on more muscle, or putting on more human growth hormone. Those are the two that I am most excited about. And I won't really say names because it doesn't really mean anything. But some of the other categories, like for sleep, there's a whole thing for sleep. One of the most huge is the whole medicine of cognition or dementia that's happening with peptides. Some of these things can actually cross the blood-brain barrier. So as we choose, how you start a protocol with this, we look at your most acute needs and move into the most chronic needs in your system. And
how about immune system, Matthew?
Oh yeah, I mean, another thing, and not to get into specifics on here with different types, but I used to work with a nurse practitioner in a provider in another practice who had a lot of issues. She was using the CBG for injuries, and the same peptide that is usually injected. Most peptides are injected, so it passes the first pass in metabolism in the stomach. They can also be put in as troches. And she had Crohn's. She had a lot of issues with GI issues. The same peptide that would be injected for one thing, say an ankle or a knee, can be swallowed and digested for the digestive system. So it's actually the same medication, but entering the body 2 different directions makes it completely different.
My favorite peptide is BP157 because
Right.
that's good for the musculoskeletal system, and it's also
Right.
very, very good for the immune system.
Yes.
So how does someone start the process of working with you for peptide therapy?
I'm going to come in and do a consultation, and we will just go through all the options. Really, I just need to do an assessment. If I don't know you, just like any other assessment that a doctor or a nurse practitioner would do, we just need to get to know you. And then once we're there, we can look at what your most critical needs are and work backwards.
Yeah. Aldo, Tom, and I, so Aldo and Tom are both clinical assistants here at Santa Fe Soul. We went to the International Peptide Conference in Vegas last year. That blew our minds, just hearing, all the different clinics that are doing studies on the efficacy of these, and people with very acute health challenges, be it, even cancer or all the epidemic of autoimmune diseases. But like anything that we do in regenerative medicine, we're looking at root cause. And it's really nice to work with something like a peptide, because as Matthew mentioned earlier, it's a natural amino acid. It's like about 50 amino acids make up peptides. And so our body it's familiar, it's nature, it's not, doesn't have all these toxic byproducts. However, you want to work with someone like Matthew because you can get into trouble. Because I mean, I have some patients coming in and they're like, they're taking 5 peptides at once and they're trying to learn it on their own. And you just got to be really careful, because even though it is a natural substance that the body recognizes, too much of a good thing or just the wrong strategy, or not kind of cycling them in, doing one and maybe doing another one. So it's a process
And
into.
it can be, yeah, and it can be a huge waste of money if you're not doing it right. If you're not doing it in the right dosing and the right order, it can be a huge waste of money. It is, fortunately, it's one of those things in medicine that I'm not as much worried about it hurting someone, because it is nature mimicking. The reason why I'm so thrilled now that I can work with Pharmakeo is a 501b pharmacy, which means their level, you see all these things. You can get peptides black market online. You can go places and do it. None of these people are 501b, which means their ability to have differences in strength is going to be completely different. They're not regulated. A 501b can only have 3% higher or lower of what they say they are. They also have to test every single batch. So we know what we're getting when it comes to that, and we know how to roll it out in order. So that gives me a lot of support. I didn't mess much with peptides until I had a good place to get it.
Let's move on to pellets. So just for all of you listening, Dr. Christy and I have been offering hormone support for the last 2 decades here at Santa Fe Soul. And, everything from Chinese medicine to Chinese herbal formulas, looking at your blood work. I also work with 3 different compounding pharmacies to do different creams, injectables. So there's many options. And I just want you to all know that pellets, some people absolutely love pellets, and some people don't even know that they exist as an option for natural hormone replacement. So we are just thrilled that Matthew now offers pellets at Santa Fe Soul.
And I've been certified for quite a while, so it's not my first rodeo. I just got back from recertification a couple of weeks ago, and it felt so good because, just a little background about me. Between now and last time I was in a functional medicine practice, I was the doctor at the men's prison in Santa Fe. I had 1,000 guys there, and it broke my heart that I couldn't practice medicine this way. I wasn't allowed. It just doesn't happen in there. Everything is kind of down and dirty with real strict West medicine, and usually the cheapest thing we've got to save as much money as possible. So it just feels so good to have this, pellets. For those of you who don't know, and again, mine are from Avexapel, so they're using that same pharmacy, so the efficacy is amazing. There are a lot of pellets on the market, a lot of practices that are doing it, but if they're not one of 2 practices, either BioT or Avexapel, you don't know what you're getting. And you'll either get really ramped up because it'll be too much, or it won't be enough and you've just wasted money again. I'm pretty frugal, and I try to make sure everything works the best for people. Usually they're inserted for a woman every 3 to 4 months. Before you do it, we have to get a mammogram. We have to see a full lab panel. I have an algorithm calculator. There's no guesswork. I load it in. It tells us exactly what we need for estradiol or estrogens and testosterones. We put them in, and then since Dr. Benson has all the adjuncts, and we have the amazing, we have acupuncturist here, we have so many other tools that even Avexapel practitioners don't have. We can support that too, So basically we put it in. About 4 to 5 weeks later, we do a post lab just to see if you're optimized up to where it needs to be. And if not, we need to put in a little bit more. We just do that. That's part of the process. And you're usually good to go for 3 to 5 months. For men, it's usually, depending on how athletic they are, about 4 to 5.5 months, twice a year.
Did you know that your body is naturally designed to heal itself? Did you know that with the right biohacks, you can have the advantage of turning back the clock and feel younger than you did 20 years ago? In Dr. Robin Benson's free fast class, she will teach you the top 5 leading edge treatments that will help you grow biologically younger, regain quality of life, prevent disease, and maintain a strong immune system. So go to top5regen.com for a 20-minute fast class and begin your own path to accelerating and supporting your natural birthright of regeneration. That's top5regen.com to discover the keys to live your best life in the body you've always dreamed of.
What's the average cost for?
It depends. I would say, I would say $400 for women is plus or minus. For men, $550 to $700. If you've got a really big guy whose optimal dosing it basically is just by the milligrams that we're needing to put in. That's basically it. And then there's an investment. There are some nutraceuticals that you really should, if you've invested in the hormones that are in your body, you need to invest in the nutraceuticals that Santa Fe Soul carries just to optimize them and keep it rolling. A lot of optimization with estrogens in a body, whether you're a man or a woman, it's very important. The body makes multiple types of estrogen. Only one is really good for you. So we have the ability to go in, optimize the good estrogen, the B17, and then reduce or eradicate the bad estrogens to get them out. And when if there's any fears about estrogen and pellets and cancer, there's so many myths going back to the 40s about it. I can show you, we have a lot of white pages here, a lot of data. We only do safe things, and we only do things to optimize the right way with the types of estrogens and hormones that do not cause cancer. So
yeah, we could do maybe we'll do a part 2 or part 3 where we'll go into all those myths about bioidentical hormone replacement therapy.
Yes.
And all that concern about cancer. And what we do know from the Women's Health Study, right, that was complete mess, right?
It was a complete mess.
Women went off their hormones. There was more suicide, more heart disease, and more cancer.
Right.
However, with the pellets and also with creams and all of the choices that we have available for our patients, we do like to check blood work or some type of saliva or urine test and see. It's quite common that if you are on bioidentical hormones, that some of those levels will be higher than when you're not, but that doesn't always mean to be, alarms should not necessarily go off. There are certain cases where I just don't think it is suitable for a woman who has a strong history of breast cancer or has just some obvious issues with estrone, at higher levels. And that could be because we live in a toxic world or people that don't have good liver detox pathways. So Matt, you were touching upon this, like in addition to getting the pellets, and for a lot of us that are on hormone replacement, it's good to be on something called DIM and or calcium D-glucarate, because that is going to help you break down your hormones in a favorable way. So it just is important because the liver has a lot of 500, 600 different jobs. And one of them is helping us break down our hormones. So it just helps the liver do its job more efficiently to make sure that you're breaking down the estrogen into the favorable pathways. But we could talk more about that at another time for sure.
It's all very exciting because it's not only medicine. The one reason why, a lot of people don't know what a nurse practitioner is. In the state of New Mexico, I have full autonomy. I can do pretty much anything a doctor can do. I don't do a lot of hospital work, but that's my choice. We do have a lot of autonomy to do a lot of things. For that reason, the other side of the coin with that is I have to be very knowledgeable and I have to be very careful. So we're careful. What I love about this whole part of the industry, though, is I never wanted to lose my creativity again. After a year of being a prison doctor and having my creativity squashed, how I'm allowed to practice or live my life, it feels so good to be in a practice where we're doing phenomenal medicine and being creative to solve problems at the same time. That's very exciting to me.
Well, it's just also been wonderful, Matthew, to have you here for acute care. When
Yeah.
somebody like desperately needs to, short of going to urgent care, the emergency room, that they know they have you too here,
Right.
along with Dr. Christie. I've been so grateful for that you do have prescriptive authority. Bridges in medicine is what we're all about, and being collaborative. But
Mhm.
thank God for some of the people that have absolutely needed some type of pain medication, in addition to some of the natural things that we're doing here. Before we end this first episode with Matthew Moody and hearing about all his great offerings at Santa Fe Soul, I want to talk a little bit about behavioral health. I mean,
Mhm.
this is a time in the world where, gosh, there's concern with cognitive decline. There's an exponential increase rate of Alzheimer's right now. And then even when we think about our youth, the levels of anxiety and stress and suicide rates are at an all-time high right now. This is one of your specialties, and I'm grateful too for the ways that you have been able to navigate people with, helping them look at their 5 different prescriptions they're on and saying, hey, this is competing with this prescription. And a lot of times, many people are on, some of our patients, some of our VAs are on like 10, 15 different drugs, and there's interactions, and there isn't the team. They don't come with the team, like 3 or 4 different people are prescribing all kinds of different medicines. And yet it's been wonderful how you can say, hey, let's prioritize 1, 2, or 3 of these instead of all that you're taking, because that really confuses the body, and it's very toxic, and it causes a lot of inflammation and other side effects.
Well, my background before being a nurse practitioner, I was a psychiatric nurse. I spent many years at the acute ward at the VA in Albuquerque. And so, yeah, I got to see that. And the reason I went back into non-psychiatric medicine, I love behavioral health. All of us have behavioral health issues. We've all got our stuff. We all need to dance with it. We all do that. That's great. And I would see, like you said, especially VA is a good example. You have so many providers through the years prescribing so much stuff. The amounts of medications build up. It's called polypharmacy, and it's not necessary. And what I hear this complaint from all the doctors is like, you go in and you see how people build it up. No one ever takes the time to take things away. And I mean, there are wonderful doctors that do spend the time trying to do that sometimes, but for the most part, you see the thing build, the pressure cooker build. And I'd really like to offer people come in and we'll just do med audits. Just either bring everything on a piece of paper, including your supplements and what you're buying at the grocery store, and what you take for pain in your medicine cabinet, or just bag it up and bring it in and let's look at it. I even have calculators, computers that I can float it all in together, and it's going to give us all the warnings, all the contraindications. I just know that as we remove things that aren't the most necessary again, and then we start replacing them with good natural care, which is what Santa Fe Soul's always been about, is we start transitioning people away from me and to more of the other holistic providers at this place, and also the magic tools Dr. Benson has spent thousands and thousands of dollars on amazing tools here that can help people. As we get bodies cleaned up, you get away from all that. We keep just what's most important, move you to our natural stuff. You're going to move forward, and it's very exciting. And a lot of times, if you have anxiety, if you have depression, if you have insomnia, if you have rage and anger, a lot of these things naturally go away once we get the body balanced. A lot of it is not behavioral health just for the sake of being wacky behavioral health. People have got, some of it is their biochemistry is just so off by the crazy world that we're living in right now and the things we're putting in our body. Once those things go away, the body naturally just kind of comes into homeostasis again. And this is a practice here that I love. Why I'm so grateful here is this is the kind of practice that's ready to catch that when it happens. So, it's like flying on a trapeze and everyone's running around on Western medicine here holding on, and you take the leap and you're getting ready to land on that other trapeze, but you're not quite there yet. And there's that minute you're in midair. And that's where we like to catch people, because that's where you can make the changes, as a person. And we're here to guide you.
Exactly. I love you use that word guide, because we do help guide you into
Oh, yeah,
one of the most important roles on this earth walk for all of us is to be our own best
it
healthcare
is.
advocate.
That
Right?
is true patient directed care. I mean, you're the patient, you're the center, and we're just here to facilitate.
Exactly.
That's what it's all about.
Exactly. And just on this note, talking about emotional well-being and natural ways to address anxiety and depression, I think we all throughout our life at some point will or have we have our dark days, right? Or some people are literally plagued with anxiety. Get to the root cause. Like, we like to find out, I mean, very often it's a deficiency. It's a deficiency in some of those macro minerals, macro in like magnesium deficiency, zinc deficiency. We see this all the time, that some of those cofactors are what are the building blocks of neurotransmitters, amino acids. So we love to help do the detective work, but we also, as Matthew mentioned, we've invested in a lot of extraordinary health technology. So one being rapid transient magnetic stimulation. This is
Thank you.
something
Yeah.
that you put on your head, and we actually like to stack it with the shaky shake vibrational plate. It's really quite powerful when you do that. But doing that maybe 5 days a week for a couple weeks, just for 20 minutes, is amazing what it does to kind of calm down that limbic part of our brain and to activate more of the prefrontal cortex. So I want you to know that we do have that at Santa Fe Soul. We also have something called a theta chamber. So very often when we're, stressed, high anxiety, that's a lot of beta brain waves, and neuroplasticity is possible for all of us. So very often that happens when when there's tools out there like meditation and biofeedback, where we get to access different parts of our brain waves, like the theta, the alpha, theta, and gamma, right? That's kind of like gamma is like when we're connected to all that is, which is so beautiful. So this particular chamber has 7 different modalities, and we program 3 different items. So like maybe sleep, or hormone balancing, or somebody who has PTSD. And then you're getting the exact sound waves and the visual patterns to help create these new neural pathways out of fight or flight. So that's something else that's really fabulous. And while we're on the subject, each year we add new goodies to our repertoire by listening to our clientele and seeing, we're seeing way more cognitive issues among, again, not just people in their 60s and 70s, but people struggling in their 40s even. But we're seeing more cardiovascular heart issues, and we're seeing more people with cancer and autoimmune conditions. So we have added something to our repertoire of ozone therapies called EBU. It's called extracorporeal blood oxygenation and ozonation. It's a powerhouse for really cleansing your body of pathogens, be it parasites, bacteria. A lot of people are dealing with mold exposure. Incredible what just 4 of those sessions can do. The other thing, people with lumps and tumors and all kinds of things, and can't get easy access to hyperthermia. We have something called the thermofield, that people who have recurring cancer or have they've discovered that they have some type of abdominal tumor, or we have somebody who comes and does full body ultrasound so we can identify these, and we're really committed to early prevention. Absolutely. Like, to be diagnosed when you're 4th stage compared to 1st stage is like everything. It's everything. So we do have the thermofield also now available, which is also incredible for pelvic floor. So we do a lot with sexual rejuvenation, helping women and with incontinence. So we're really thrilled that the thermofield is fantastic for that as well. Yay!
I love that. And then, going full circle, that, takes us back to hormones, peptides, everything. The sexual rejuvenation that we do here is profound. If you're having any issues, people may or may not know about it, but pelvic rejuvenation is amazing. And that goes hand in hand with making sure your hormones are right. And my degree was basically a degree in part of it was men and sexuality. And so it served me well in a prison and at the VA, and I'm seeing it here too. It's just everybody's got these issues, and there are, I don't want to even call them hacks because they're not hack, is something that's being used for a side use for something else. We've got very specific ways of fixing problems here.
Yeah.
And I'm so impressed. Yeah.
We test everybody that comes in with any type of pelvic floor sexual rejuvenation. Gosh, I just want to mention like how like 30% of women have some type of sexual dysfunction, whether it's they can't experience orgasm or they have dyspareunia, pain with sex. I mean, there's lots of different areas. In fact, we're going to do an open house, right? One night we're going to invite you all that live locally to really learn about this part of your body that you want it. There's no reason you can't have great sexual connection and intimacy for the rest of your life. But it's one part of our body that we often dismiss. We don't listen to our body. We just stop all type of sexual connection because we're afraid to talk about it. But it's nice to know that there are these natural remedies, that natural techniques and technologies that we have that are super easy to receive and to have those conversations, right? Because it's about our cardiovascular system to have a healthy sexual experience, right? It is about our sense of body identity. It's really knowing yourself intimately before even trying to do it with somebody else, right? So there's all kinds of ways that we support this. And it's been wonderful to have Matthew here too, because gosh, 50% of 50-year-old men, 60% of 60-year-old men have some type of erectile challenges. And honestly, whether we look at it, the broad spectrum, sometimes it's hormone replacement. Sometimes somebody comes in and they're a diabetic or they have cardiovascular heart issues, and we really need to clean up. We need to help these particular guys detox, right? So, oh my goodness, I'm so happy to take this time with you, Matthew, to share all the goodness of you being here. Our patients have just loved you. Every single one that's worked with you, it's just been such a blessing. And for all of you, just know that we're a phone call away. We do answer the phones here. Isn't that amazing? We have such an incredible team. Gosh, Tom's been with us for 12 years, Dr. Christy, 10 years, Aldo for almost 7 years. So we are seasoned and we keep stretching. We keep serving all of you as best as we can, and do respond to, if you happen to be listening to this as a podcast or one of our patients, you'll get this. Certainly everybody who comes to Santa Fe Soul will be able to hear this. If you have any questions, if we piqued your interest and you're like, oh my gosh, I want to know more about pellets, I want to know more about peptides, I want to know about all your offerings for memory, we have a pretty amazing menu of goodness for you here. So,
and I'll tell you, since I've been here too, it blows my mind how many people actually come in and use, and of course we're in Santa Fe, which is awesome too, that come in actually as a destination trip to work with Dr. Benson and to experience Santa Fe Soul and to experience Santa Fe. I can also help if people can't come in. There are Avexapel practitioners all over the place. I can help get you to someone in your area if you're not in the neighborhood. But I also want to invite you to come in and just play with us too. Spend a week. Come just do it.
Yes.
Dr. Benson does. We had people from Dubai here last week.
We do almost every week, every other week, have our VIPs, that come in and do deep dive in regenerative medicine, that want to do a natural facelift, that want to work our EBU system and have some health challenge going on. And we have somebody from Montana here with us right now. So, and then we bring in couples. We have a couple from Canada that's come to visit us a couple times. It's really powerful when you take that time out of your schedule for just you, to focus on you. You are the most important person in your life, right? And taking care of your vessel is everything. So just know that that's another way that we can work with you. So thank you, Matthew. Thank you.
Oh, thank you.
For this
Thank you,
time.
Dr. Benson. I appreciate it.
Yeah, and thank you, all of you listening. Again, we are just so grateful for you and all the ways that you've been part of our life over, Santa Fe Soul for almost 20 years and my practice for 32 years, and just all the amazing people that have come through these doors. We are alive and well and just doing some of the greatest things possible in regenerative medicine. So give us a call. We're here to help you.
What did you think of today's show? Let us know when you write your review and subscribe on iTunes or Stitcher today. Receive your chance to win a VIP day, $10,000 value with Dr. Robin Benson. When you review and subscribe with your name, we enter you in a drawing for a VIP day at the Brain Optimization and Body Regeneration Studio in Santa Fe, New Mexico. Get ready to experience the latest science to feel and look younger in your body naturally.